Here at home, heroin and opioids have taken a heartbreaking human toll in every corner of Monroe County. Our medical examiner's office has determined that over 200 deaths across our 10-county region were directly attributable to the use of heroins, opioids, fentanyl, or other related substances in 2016. Today, we're announcing our Monroe County's Opioid Action Plan, a wide-ranging approach to this crisis that recognizes the important role that county government can have in supporting prevention, treatment, recovery, and law enforcement. Our Opioid Action Plan consists of several components, each intended to tackle a different aspect of the epidemic. Some of these components are already underway, but each one has and will continue to have an important impact on the lives of those affected by heroin and opioids. Today is the first plank of our Opioid Action Plan. I'm proud to announce that Monroe County has officially joined the lawsuit and filed our lawsuit in New York State Supreme Court as of just before noon this morning. Through this lawsuit, Monroe County intends to hold those pharmaceutical companies and individuals accountable for their actions in order to recoup those funds for taxpayers and the very real everyday people in our community who have suffered as a result of this opioid epidemic and crisis. When we are successful in our lawsuit, we plan to use the financial judgment awarded to us to reinvest in an increased prevention, treatment, and enforcement. We look forward to assisting in this lawsuit in whatever way possible in the days to come. I believe that we can and should do more to remove the barriers for those who are seeking treatment for heroin and opioid addiction. In fact, it's often said that the most important time for anyone struggling with addiction is the moment they decide to seek help. That's why I recently asked Dr. Mendoza to convene a brand new advisory panel on opioids, where some of our area's foremost medical experts will share their opinions and suggestions on how we can better improve the system of treatment in our community.
We need actionable data. With these data, we can conduct surveillance, much as we do for influenza, for Zika virus, for lead poisoning, just to name a few. And while we continue to pay great attention to mortality data, other data are clearly necessary. I am working with various community partners, from law enforcement to our first responder community, and of course with our local hospitals, to ensure that all agencies working on this problem have access to the data.
Without a doubt, Monroe County has some of the finest medical care in the nation. We have long been a leader in this field. But if we're going to make a dent in the opioid crisis, we have to have cooperation. Cooperation is the key. To have representatives from our largest healthcare institutions in our region serving on the same panel for the same cause is an incredible asset in our efforts to move forward.